Hi, I'm Jane Wahaya, Nutrition and Administrative Services Consultant in the Ohio WIC program. Today's presentation on nutritional considerations for infants born with Neonatal Abstinence Syndrome, or NAS, is State WIC's response to a request from Ohio WIC health professionals and is in recognition of the increased incidence of NAS in Ohio. The rising incidence of babies born addicted to drugs suggests an urgent need for healthcare professionals to gain understanding of these babies' problems and needs. Our ability to recognize symptoms, assess their nutritional significance, and make appropriate recommendations for care is critical for their well-being.
Let's start by looking at a couple of definitions. In July 2014, the journal Pediatric Nursing published this definition.
NAS is a group of behavioral and physical symptoms caused by withdrawal from pharmacological agents.
In the 2015 edition of the medical textbook Beyond the NICU, Comprehensive Care of the High-Risk Infant, NAS is defined this way.
NAS is a group of clinical signs in a neonate resulting from prolonged exposure to illicit or prescribed drugs.
Neonatal abstinence syndrome is diagnosed clinically with the use of scoring tools. These will not be discussed in this video, since diagnosis is out of our scope of practice.
The risk of developing NAS and the need for pharmacological intervention is reduced by prematurity. This is because of lower total exposure time compared to term infants and lower storage in fat cells. However, infants with NAS are often premature, growth restricted, and present with low birth weight. Risk codes 142 for the infant born early, 141 for low birth weight, and 151 for small at birth correspond to these conditions. See the risk code PowerPoint training for additional information on these codes. The new WIC certification system will include a risk code specific to infants with NAS, code 383. Health professionals will need to begin using that code when it is available. Until then, use risk codes corresponding to symptoms the infant exhibits. We know that alcohol exposure in utero may also predispose a newborn to symptoms of withdrawal. Although this group of infants will have their own code, 382, many of the symptoms in the table above apply to these infants as well. Although Food and Nutrition Service differentiates withdrawal from drugs and withdrawal from alcohol, textbooks and journals commonly refer to them together under the NAS umbrella. Symptoms experienced by the infant in withdrawal can be numerous. Onset, severity, and length of time they persist are dependent on several factors, such as the infant's gestational age, the substance they were exposed to, the amount of the substance used, and the length of exposure. Symptoms of neonatal abstinence syndrome can appear almost immediately or can be delayed hours, days, or weeks. NAS babies often experience longer hospital stays and a higher rate of readmission than non-exposed babies. The risk of sudden infant death syndrome, or SIDS, is also higher for babies with NAS. Symptoms resulting from alcohol exposure in utero can range from mild to severe and may appear even months after birth. This presents the need for monitoring throughout infancy. NAS infants who have impaired feeding behaviors and a higher metabolic demand typically have difficulty gaining weight. In addition to the need for extra calories, vomiting and diarrhea can increase fluid and electrolyte needs. Skin breakdown caused by diarrhea may increase protein needs for healing. With problems such as these, it's easy to understand why babies with NAS may not be able to take in enough nutrition to meet the needs of their rapid growth and development, coupled with the demands of their illness. Some symptoms are related more to one type of drug exposure than another. Opioid exposure is more likely than other drugs or alcohol to cause NAS symptoms in an infant. On the Ohio WIC Health History for Breastfeeding in Postpartum Women, there are 4 places where mom can enter information that directly states her baby was exposed to drugs or alcohol in utero. On the front of the health history, there is a space for the mother to enter any medicines she takes. If the mother reveals that maintenance therapy drugs are being used, the health professional can ask the mother if she is compliant with her maintenance program and has adequate support at home. The health professional can proceed with questions about mom's ability to properly care for her baby, keep doctor's appointments, and inquire about any symptoms the baby may be experiencing. Using approved methods, such as stages of change or motivational interviewing, the health professional should praise mom for her efforts and encourage her to continue any good habits she has attained. If problems such as non-compliance with therapy or poor weight gain in the infant are discovered, the mother should be counseled on the possible consequences of continued exposure of the infant, and referrals to other healthcare providers may be needed. Other areas of the health history where mom may indicate directly that her baby may have NAS are on the back side of the form. Where the form asks, "Was your baby born with any health problems?" mom may write in withdrawal or NAS. On the section stating, "Check all alcoholic beverages you drink," she may state that she drank alcohol during pregnancy. And near the bottom, where it says, "Check all drugs you currently use," she may list licit or illicit drugs that were abused during pregnancy. In these cases, the health professional has an open door for respectful discussion. More often, however, caregivers may not be forthcoming with the infant's diagnosis of NAS, and an addiction history may not be available at the initial assessment due to the stigma of addiction. The mom may complain of such things as weak suck, slow weight gain, reflux, poor sleep, or constant crying. Without documented medical history or self-report from the mother, nutrition screening requires health professionals to use critical thinking to identify indications of NAS. Even though not all infants with such symptoms have neonatal abstinence syndrome, and the role of the WIC health professional does not include diagnosis, babies who exhibit some of these symptoms should receive a careful assessment for special needs, and an appropriate plan of care should be developed and discussed with the caregiver. Implications for WIC Nutrition Services for babies with NAS are included in the risk code definitions from USDA. The first recommendation for WIC staff is to assist caregivers by educating them to recognize hunger cues. Because these babies often have trouble gaining weight, it is important for caregivers to understand when the baby is ready to eat so they can feed them optimally every time an opportunity exists. Second, WIC staff can assist caregivers by reviewing feeding frequency and formula type and amount to help manage gastrointestinal symptoms. For example, if the infant is experiencing gas pain or diarrhea, low lactose formulas such as Gerber Good Start Soothe could be helpful. If nutrition is being impeded by vomiting or reflux, a low osmolality formula such as Enfamil Enfacare Ready to Feed, or a thickened formula such as Enfamil AR might be helpful. Recommending bottles and nipples that reduce air swallowing may also help. Third, WIC staff can assist caregivers by providing growth monitoring to assess adequate weight gain. Because this is often a problem for babies with NAS, weight should be monitored frequently and feeding tolerance assessed until baby is stable on a regimen that promotes acceptable growth. Small frequent feedings of high-calorie formula are often recommended. Formula manufacturers often provide apps with directions for mixing formulas at higher calorie levels. If baby is having trouble gaining weight, work with the infant's physician after receiving consent from the parent or guardian. Some high-calorie formulas and additives in the current Ohio WIC formulary include Enfamil Premature 24 calorie, Similac Special Care Premature 24 calorie, Similac Neosure, Enfamil Enfacare, and Human Milk Fortifier. See Table 310A in the Ohio WIC Policy and Procedure Manual for more information on formulas. Another way WIC staff can assist caregivers is by encouraging supportive interventions for comfort, including skin-to-skin contact, swaddling, and a quiet environment. According to the journal Pediatric Nursing, July-August 2014, many babies with NAS do not tolerate noise or bright lights. The health professional might suggest the mom try to keep the environment quiet and the lighting level dim. Although it requires training and is not done in the WIC office, infant massage may sometimes be used to help comfort the baby. Lucas County's breastfeeding coordinator, Gloria Shortridge, states,
"This should be utilized on a case-by-case basis, as NAS babies are very easily stimulated and sometimes massage can irritate them. Massage has been useful for weight gain and feeding issues, so I offer it to moms as an alternative when they are not able to console their baby. It's a wonderful thing when it works."
The health professional may want to ask mom if she would like information on infant massage. If so, the following links could be shared. Breastfeeding is encouraged for babies with NAS unless mom is abusing licit or illicit drugs, refusing substance abuse treatment, or is HIV positive. Breastfeeding can help comfort the infant suffering withdrawal symptoms. It can shorten the withdrawal period, lessen severity of symptoms, reduce length of hospital stay, and lower the need for pharmacological intervention. Lactation support is especially important for these babies. Mothers should be counseled on the importance of gradual weaning when mutually desired by mother and infant. Mothers who are compliant on medication-assisted therapy while breastfeeding should be encouraged to speak with their healthcare provider if they have questions about the timing and dose of their medication. Community resources such as support groups and medical and mental health care providers are some of the possible referrals that may benefit mothers of NAS babies. Connecting moms with services that benefit both her and baby could make the difference between success and failure, where such things as weight gain, maintenance therapy, and breastfeeding are concerned.
Babies with NAS are commonly readmitted to the hospital in the first month following discharge. Therefore, an important goal for the WIC health professional is to help avoid readmission. WIC can help accomplish this goal by addressing any feeding problems early, monitoring growth carefully, screening the mother's ability to properly care for and feed her infant, and through appropriate breastfeeding counseling. We hope this review of the nutritional needs of babies with neonatal abstinence syndrome has been helpful to you. The references available with this presentation provide more detail. Thank you for viewing. Stay healthy, Ohio.